we would encourage persons who live around the area to come here. Of course, they can go other places. I guess they can go to Georgetown Public Hospital. But the idea was to kind of relieve the congestion at that one center. So we have on the East Coast corridor, and we have here.
Okay, so you have staff. That's sufficient staff to man this unit. And how long will it be open for? From what time in the morning to what time in the night, or is it 24-hour service? What is it?
It will depend on the demand. We're not certain how long we will be here for, but we'll certainly be here for as long as there's a demand for the services. And likewise, at this point, we're thinking of regular working hours. But there's a possibility, if there's a high demand, for that to be extended. That can also happen. I think I should also mention that being a mobile unit, we also have plans for the unit to go into other areas where what we consider hotspots, where we've had a few cases emanating from, just to go and check and see what's going on in that facility. We're also thinking of places like the markets, where we recognize from our epi data that a lot of the contacts of our cases would have traversed certain marketplaces. So it's also worth our while, I think, for us to go and check some of the market vendors. Since they're going to be interacting with the public, it's good for us to know how many of them may be carrying or may be symptomatic. So after samples are gathered, they go to the National Reference Laboratory, where they're prepared for testing. There's capacity for over 40-something tests to be done at any one point in time. We haven't even used our maximum capacity at the lab in terms of quantity of tests, so we can actually increase the numbers that we're doing. So this effort will help us to reach at least closer to our full potential in terms of testing.